Namaskar. Welcome to the session on Nutrition and Healthcare Sciences. In this session, we are understanding vital parameter health check. Generally, human health state is defined by variety of physiological parameters which are usually interdependent. It is a fact that all those parameters are not equally informative and important. Even controlling them frequently is very difficult in day-to-day business using expensive medical equipments and checkups. While designing the overall monitoring system, it is necessary to assess not only importance of measured parameters, but also techniques of their measurement and potentiality of implication into practical systems. Hence, in this unit, let us understand vital parameters for health, including vital signs of normal body functioning such as heart rate, blood pressure, respiration rate, temperature and even pain. This unit contains the information on cardiovascular system parameters, respiratory system parameters, body temperature, pain, hyperglycemia and hypoglycemia and even other vital signs of health. The first one is cardiovascular system parameters. The prime heart work related physiological parameters are heart work rate, we call it as pulse, and blood pressure. Practically, they could be obtained in several ways. The first method is measuring the pulse. The pulse rate can be recorded in radial, that is in the wrist, usually at the base of the thumb, carotid on each side of the neck, apical over heart with a stethoscope, and even other parts such as dorsalis pedis. To palpate pulse, place fingers just lateral to the extensor tendon of the great toe. Posterior tibial. To palpate pulse, place fingers behind and slightly below the medial malleolus of the ankle. Manual palpation in simple, let us understand how to take an individual's pulse. Place 2 or 3 fingers over the radial artery in the wrist. Count beats for 60 seconds using watch or clock with a second hand. Recount beats if pulse is irregular. Note regularity and strength of the beat. Document and report any irregularities. So, what should be the precaution we take? Do not use the pad of the thumb due to presence of an artery in your thumb. Use the pads of the index and middle fingers of one hand over the site where the pulse is to be measured. Do not press too hard. Measure it in beats per minute, called BPM. Use a watch or a clock to record. Once a pulse is palpated, count beats within a specific interval of time, example 60 seconds. So, which is going to be most accurate. 15 seconds you can multiply it by 4, 10 seconds you can multiply it by 6. If it is less than second, it is not precise. Shortcuts will also be employed, but they will increase errors. Actual is going to be 72 BPM, miss 1 in 60 second count. So, it is going to be 71 BPM, which will show 1.4% error. Miss 1 in 10 second count, 66 BPM. So, that will show 8.3% error. Therefore, start the time period of counting at a specific time on the watch, and the first heartbeat felt after the time period has begun is considered as beat 1. Keep this resting heart rate in your mind. Adult norm, it is 60 to 100 BPM. Infant or children norm is going to be 80 to 100 BPM. Bradycardia, it is less than 60 BPM. Tachycardia greater than 100 BPM. The following guidelines are based for patients without cardiovascular pathology. To calculate the highest heart rate a person should achieve upon exertion with respect to age, that is 220 minus patient's age is equal to maximum heart rate. Example, if the patient is 47-year-old, 220 minus 47, that is equal to 173 BPM. Stethoscope. It is a medical instrument for listening to the action of someone's heart or breathing, typically having a small disc-shaped resonator that is placed against the chest and the two tubes connected to earpieces. While using, it is important to clean the earpieces because it can spread diseases with sharing of earpieces. It also contains wide tubing which is flexible and free of cracks. Another component is bell or diaphragm, which is an enlarged metal or plastic attachment on the distal portion of the stethoscope to be applied to the skin of the patient. It amplifies the sounds being made by the body underneath it. While using it, test for sound with a light tap to make sure that the side down is active. Bell helps in hearing low frequency sound for smaller areas of contact. The two values make up the blood pressure is generally means systolic pressure, how much pressure the blood is exerting against the arterial walls when the heart is contracting, the first sound heard during reading. Diastolic pressure, how much pressure the arterial walls are exerting on blood when the heart is not contracting, the last sound heard during the reading. Generally, systolic reading is 20 mmHg, that is millimeter of mercury, and a diastolic pressure is 80 mmHg, which is documented as 120 over 80 mmHg and verbally reported as 120 over 80. Blood pressure should not be measured on arm with lymphedema, ipsilateral site of recent mastectomy, over open wound and on dialysis shunt. How to take an individual's blood pressure? Clean earpieces and diaphragm of stethoscope with alcohol and cotton balls. The diaphragm is the larger round side of the stethoscope. Locate the branchial pulse on the inside of the elbow. It is about 1 to 1.5 inches above the elbow. You should be able to feel a strong steady pulse with 2 or 3 of your fingers. Wrap and fasten deflated cuff smoothly and snugly around person's upper hand. Place cuff at least 1 inch above elbow. Point arrow on cuff at branchial pulse. Place earpieces of stethoscope in your ears. Place diaphragm of stethoscope over the branchial pulse. Close valve on air pump. Turn knob to the right to close. Pump air to inflate cuff until the dial points to 170. Deflate cuff slowly and at a constant rate turn knob to the left slowly. Watch numbers as needle falls. Listen for the first thumping sound. Note number where first thump, systolic pressure, is heard. Note number where last clear thump, diastolic pressure, is heard. Deflate cuff completely. Document and report any abnormal readings. So, what are the general norms? Systolic less than 120 mmHg, diastolic less than 80 mmHg. Let us understand red flags to examine cardiac status. Systolic does not rise with activity. Diastolic increase greater than 20 mmHg during activity. Diastolic decrease greater than 10 mmHg with activity. Resting systolic greater than 200 mmHg. Resting diastolic greater than 110 mmHg. Hypertension is a persistently greater than systolic 140 mmHg over 90 mmHg. Hypotension is commonly a systolic blood pressure of 90 mmHg or below, but is also related to the patient's normal BP. For example, 110 over 70 in a patient that is normally 180 over 110 is hypotensive. Orthostatic hypotension. In adults, moving from a flat horizontal position to a vertical position results in pooling of blood in the lower extremities. People with healthy, intact autonomic nervous systems reflexively compensate for the volume shift by increasing the rate and force of myocardial contraction and vasoconstriction. thus maintaining adequate blood pressure. Even with normal compensation, however, a position change usually results in a drop in systolic blood pressure and an increase in heart rate. The another method is the electrocardiogram. It is one of the most representative characteristics of heart work. ECG represents Ort's electrical activity recorded from electrodes on the body surface. The sinus node in the heart is one of the cardiac conduction system elements that control the heart rate. It generates electric impulses and conducts them throughout the muscle of the heart, stimulating the heart to pump blood. The electrical signal generated by the sinus node moves from cell to cell down through the heart, and so induced and not induced spatial areas in the heart are created and obtained using the ECG. Despite the fact that most of the physiological examinations of the human health state nowadays include ECG measurements, telemetric ECG signals acquisition, especially meanwhile patient's physical activity, is still rather complicated task. In exercise ECG, the signal is distorted because of muscular activity, respiration, electrode artifacts due to perspiration and electrode movements. This requires additional signal conditioning means. Auscultatory method. The indirect auscultatory method of blood pressure measurement is commonly used today. With this method, the pressure is determined by use of measure device called sphygmomanometer. The cuff used in this case is inflated to a level above arterial pressure. Then the cuff is gradually deflated and the pressure is noted, at which sounds produced by arterial pulse waves appear and disappear again as flow through the artery resumes. Indirect measurement auscultatory method is sufficiently accurate for medical diagnostic purposes. Automatic instruments. Most automatic instruments used for blood pressure measurement uses oscillometric method. This is more indirect method and instruments are usually empirical, calibrated against the auscultatory method. Automatic instruments work on the principle that when the artery does open during a portion of the pressure cycle, a tiny perturbation or oscillation will be superimposed on the pressure inside the cuff. The second one is the respiratory system parameters. Respiratory ensures the circulation of the oxygen into the human body. Special medical equipment is required to record respiratory characteristics, so called respiratory system parameters. Those parameters featuring human health state consequently can be divided into three groups: volume parameters, respiratory system physical parameters, parameters of gas metathesis within the lungs. Volume parameters, the total lungs capacity, tidal breath, functional remaining capacity and others, characterizes potential and functionality of human body parts that responds for respiratory functions. Physical parameters are related to mechanical model of respiratory system. Respiratory rate is one of those parameters. Gas metathesis parameters are related to gas penetration into human body and exhausting from it when breathing. All those parameters are interdependent and measurement of some of those parameters gives us possibility to calculate the rest of them. Both conventional and remote measurement of respiratory system parameters traditionally uses respiratory masks, which are not much compatible with telemetric principles of measurement. Recent trials to perform precise measurement of respiratory system parameters using alternative mask-free measurement methods adduced ambiguous results. Indirect mask-free methods evaluate respiratory parameters according to some other physical body parameters like recurrent impedance of human body tissues and others. The main problem is the accuracy of the results, since most of known methods are sensitive to human body movements and that introduce significant errors into respiratory parameter measurements. Measuring rate of breathing includes cycles of inhalation and subsequent exhalation. It can be done by auscultation, that is listening with stethoscope, visual, auditory or palpation observation. Visual and auditory measurements are unobstructive and can be made without the patient knowledge just prior to or after taking a pulse. When the patient is breathing too shallow or quietly to easily measure using auditory or visual observations, then you can either use a stethoscope to listen or place your hand on the patient's thorax or use the dorsum of your hand close to but not touching the mouth or nose to feel the airflow. The normal resting respiratory rates are as follows: for adults 12 RR per minute, for children 20 RR per minute, for abnormal condition less than 10 or greater than 20 RR minute is observed. We have to keep it in our mind that RR is influenced by pulmonary pathology, cardiac pathology, deconditioning, pain or anxiety, medications, etc. In simple, how to take an individual's respiration rate. Place your fingers on the person's wrist, count person's respiration for 60 seconds, that is inhalation and exhalation is equal to one breath. Note any irregularities, document respiration rate and any abnormal findings or irregularities. The third one is the body temperature. In a healthy individual, body temperature is kept constant in a very small range despite of big difference in temperature of the surroundings and also those in physical activity. This is achieved by systemic nervous regulation. Body temperature regulation requires the coordination of many body systems. For the core temperature to remain steady, heat production must equal heat loss. The hypothalamus located in the pituitary gland in the brain is the body's built-in thermostat. It can sense small changes in the body temperature and stimulates the necessary responses in the nervous system, circulatory system, skin and sweat glands to maintain homeostasis, that is state of dynamic equilibrium. Nervous system maintains the optimal intensity of metabolism and at the same time regulates the amount of heat loss. Overall, human body temperature is rather different, especially within inner and outer parts of the body. Temperature measured in anus is about 37.1 degrees centigrade, in mouth 36.7 degrees centigrade, in armpit 36.5 degrees centigrade. For a healthy person, this temperature is almost invariable and depending on person may deviate only plus or minus 0.4 degrees centigrade. Body temperature changes are more intensive in young person than in old people. The temperature may slightly or temporarily increase in hot environment. Physical activity may also increase the body temperature. In extreme effort, the increase may be very high. The temperature in marathon runners may increase to 39 degrees centigrade or 41 degrees centigrade. The temperature may increase slightly if vasodilation, hyperventilation and other compensation mechanisms fail. The range of temperature in an adult depends on age, ovulation, site of measurement, time of day, physical activity, status of hydration and state of health including presence of infection. Let us understand how to take an individual's temperature using a digital thermometer. Use a plastic slip to cover the thermometer. Press the button to set the thermometer. Place the thermometer under the tongue. Have individual closed mouth for several minutes. Take the thermometer out of the individual's mouth to read when the temperature indicator lights. If the individual is unable to keep the thermometer under his tongue, you may take an auxiliary temperature under the armpit with tip of thermometer against dry skin and held in place by the arm, waiting for 5 minutes. Let us understand the advantages and disadvantages of recording temperature in different sites of the body. The oral. So, the advantages are is it is easily accessible, it is comfortable and it is going to be accurate, and it will have some disadvantages like delay in measurement if hot or cold drinks taken. Do not use if hand, oral surgery, trauma, epilepsy or shaking chills, confused or unconscious. Risk of body fluid exposure. So, we can also measure the temperature in axilla. So, the advantages are it is non-invasive, safe, can be used if patient unconscious, seizure. But it will also have disadvantages like long measurement time for 3 minutes, requires exposure of thorax resulting in temperature loss. The tympanic also be used for the measurement of temperature. The advantages are it is easily accessible, rapid, accurate and minimal disturbance required for disposal. The disadvantages are it may lead to low or high readings. We should not use if surgery to ear or tympanic membrane, requires removal of hearing aid before measurement. Sensor cover is available in only one size, disposable or expensive. We can also measure the temperature rectal at the rectal site. The advantages are it is accurate, reliable when the oral temperature cannot be obtained, but disadvantages are many. The poor during rapid temperature change, do not use with diarrhea, rectal surgery or bleeding tendencies, and it is an embarrassment and anxiety, requires lubrication, body fluid exposure. Telemetric measurements of human body temperature usually employ electronic temperature sensors such as thermocouple or thermoresistor. Such sensors allows measurement to be done fast, about 1.5 minutes, and all measurement procedure is well established. Along with this, the skin temperature provides information concerning circulatory status, potential peripheral nerve injury and local inflammatory responses. It can be done manually. Use the dorsum of your hand lightly on the skin, moving it slowly distal to proximal, noting any temperature changes. It is helpful to do this on both left and right to compare. The fourth one is the pain. It is a subjective perception described by patients. These perceptions are unique to each individual and may depend on previous experience, type of injury or disease, body part affected, age, time, sense onset and ethnic background. Documenting pain levels is useful to help the patient determine diagnosis and prognosis, determine appropriate interventions and to measure the patient's response to interventions. Pain is measured by visual analog scale, that is VAS, marking their pain levels on the visual line from 0 to 10. The common adaptation called the NPS, numeric pain scale, which is to ask patients to provide a number between 0 and 10 that represents where they rank their current perception of pain. The last one is hypoglycemia and hyperglycemia. Hyperglycemia. For hyperglycemia treatment, insulin should be given in a hospital. A children 0.25 to 0.5 U per kg and adults 10% to 20% of the total daily dose. Hypoglycemia, the treatment includes when a patient has severe hypoglycemia and becomes unconscious, it should be treated with an emergency glucagon kit which requires a prescription. After injecting glucagon, follow with blood once the person regains consciousness and is able to swallow. Treating a conscious diabetic patient. If the patient is conscious and coherent, check their blood sugar level. If the person is behaving oddly and is suffering from hypoglycemia, but is still conscious and capable of swallowing, then feed them sugar like fruit, orange juice, glucose or white sugar dissolved in juice or water. If not, call emergency services and keep trying. If the person is unable to swallow or you are unsure if they are capable of swallowing, then try rubbing some sugar or glucose gel on their gums. If suffering from hyperglycemia, do not feed the patient, push water while conscious and get the patient to medical treatment promptly. Treating an unconscious diabetic patient. If the person is unconscious, dial emergency services and put the patient in the recovery position, monitor vital signs. If the patient is unconscious and having seizure, please call the emergency services and follow the first aid protocol for seizures. That removes anything on which the patient could injure themselves and put in the recovery position once the seizure is over. So, let us understand the other vital signs and symptoms need to be observed for the healthy living. Wound will have pain, swelling, redness, tenderness, pus or red streak. If there is any problem in the throat, pain with swallowing, refusal to eat, redness, whitish patches at back of the throat, hoarse voice, fever or skin rash. If there is a problem in ears, you will have pain, pulling at the ear, redness, fever, discharge, diminished hearing, could be allergy if discharge is clear, infection likely if discharge is yellowish or greenish. If you have a problem in eyes, you will be having redness, swelling of the eyelid, eyes burning or painful, or there could be also drainage. The teeth will show the indications of pain, refusal to eat, gum bleeding, facial or gum swelling, including fever. Respiratory system problems includes the cough, shortness of breath, wheezing, fever and even mucus, etc. Digestive system will show abdominal pain, vomiting, loose stools, constipation problems. Urinary tract will have difficulty in urination, loose stools, pain or burning, change in urine color, clear to cloudy, light to dark yellow, and even it shows the symptom of fever. The toxic shock syndrome shows the vomiting, fever, pain in one or both sides of the mid back, vomiting, diarrhea, nausea, chills, rash, especially during menstruation. Vaginal infection generally shows the indications of discharge, itching, burning, unusual odor. So, let us conclude the session saying, along with these other biochemical parameters generally carried out in the diagnostic laboratories, will add more information on the functioning of the specific organs. A regular checkup and maintaining these parameters are the secret of health. Thank you.